Okay, here we go. Another episode of What's for Dinner. Hope you guys are all doing good. It's about, 10 minutes after 5 on...
It's late.
It's late for us, yeah. 10 minutes after 5 on Thursday afternoon.
Yep.
Beautiful day today.
Yep.
Hope you're all doing well. So what's going on today?
So we made 5 fillets because you don't know who's coming or going.
Yeah, those kids.
And then you put butter on yours and I'm putting some butter on mine.
Yeah. And then we have some air fried bacon that Teresa just made up in the air fryer. That guy right there.
Yep. It's very loved.
My butter's falling off of there. Can you fix it?
No, you can just add more.
Oh, that's true. I can.
Will not be helpful.
Yep. And then we got some, these are store-bought eggs, aren't
Yes.
they? Okay, yeah, we didn't have the farm fresh ones today, but we have store-bought eggs. And then, what do we got going on here?
Shrimp Alfredo. So I use cooked shrimp, so I don't have to worry about nothing. But then I put in a block and a half of cream cheese, a stick of butter, and then I just put in some shredded Parmesan, and then garlic cloves.
Okay.
And I mix that up, and then I put this shrimp in.
This didn't go too long. It didn't take you too long to cook up, did it?
No.
Okay. Yeah, so you were busy doing all this stuff inside here while I was out grilling the steaks.
Yep.
And what else do we have going on here?
That's all.
Okay, so, and then you see that big pound of butter over there. That's the butter that I'm using. And Teresa likes the Kerrygold. That's, for those of you who didn't see this a couple of days back, we got a pound of, it was Amish, thank you, Amish butter.
Yeah.
So it's really, really good. It's local, so we enjoyed it. All right. So any of this stuff we cooked tonight cause our blood sugar or insulin to spike?
No. Unless you eat carbohydrates with it.
Okay.
And remember, carbohydrates does not mean chocolate cake at the end. It means baked potato, mashed potato, sweet potato, rice, pasta, a roll.
What about baked beans?
I used to love baked beans. Baked beans will spike your sugar. They are so full of sugar.
Yeah, like Bush's and stuff, they put a lot of brown sugar in it, and it's delicious, but, and the legumes in general are kind of high on carbs.
Yeah.
So, yeah.
So the key is to keep your blood sugar low if you want to prevent disease, if you want to reverse disease, all of that stuff, keep your blood sugar low and your insulin low.
Okay, so carbs and sugar.
Yep.
Let's manage that.
Yep.
All right. What do you got going on down here? You've been talking, you have this thing that you're going to be talking about tonight. I don't even know what it is. Did something happen at the office today or something?
Yeah, I told him I wasn't going to tell him the story, but I told him who it was, so he'd know who we're talking about. But this is what I go through every day, okay? It's your stories. You go through it because you're dealing with the provider. I go through it secondhand, hearing your story and getting annoyed. But this is what I deal with, is all of this information about hormones, bioidentical hormones. So this chart was on my desk today. This woman, I'm pretty sure she's in her 70s. Someone could do the math. She's was born in 1947. She's been with me on hormones for a long time. And she does have factor V Leiden, which is a clotting disorder. If you have a clotting disorder, I don't put those people on oral estradiol, not because oral estradiol causes clots, but because oral Premarin, pregnant horse pea estrogen, does, and providers get it confused. And I just think that would cost me probably $50,000 for an attorney to hire experts to comb through the literature to say, oh, that's Premarin, not estradiol. So I give those women cream transdermal estrogen. There has never been a study showing cream transdermal estrogen causes blood clots. So it is forever safe. All hormone doctors can put females that have had clots on transdermal estrogen. I just lost my train of thought. Mm-hmm. So this woman's been with me for quite a few years, her and her husband, done well, and on low carb and all that. So she has factor V. She has a clotting disorder. In March, she went to the ER and had multiple clots forming. So was put on a blood thinner and then sent to a hematologist. So the note to me today said, specialist told her to DC all BHRT due to blood clots.
Discontinue?
Yep. So first of all, I'm like, a hematologist should know these things, but we don't really learn. Hematologists are going to school for oncology and iron infusions and all that. They might get a blip of hormones, but he doesn't know hormones. He should not be giving information to my patients. That's called misinformation. If you don't know what you're talking about, you shouldn't spout it, because providers like him are preventing women from getting help, okay? If you tell a patient, all the time I get patients that are late to me because they say, I was told I had a stroke or had a problem on birth control, so I was told I could never go on hormones. That's not true, okay? Number one. Number two, he says DC all BHRT. What about testosterone that she's on? What about thyroid that she's on? And what about progesterone that she's on? Why would she have to go off those? There's never even been a question of a study with clotting. The confusion is pregnant horse pea, synthetic estrogen, and my estrogen. So why can't she stay on those? Why does she have to go off all? And she told him, I rely on progesterone for sleep. And he said, too bad, you'll have to find something else. So anyway, this was their exchange. I did like little quotes and did everything she told me that they said. The problem is this woman is pretty. She is smart. She is educated. She's not afraid to say what she knows. And it literally irritated that doctor and his ego. He's a little, okay, well, anyway. So he told her, I know people love their hormones because they feel better, but you have to come off. And then he ordered another factor 5 panel. It's genetic, it's there. If it's there, it's there. Even though she told him, I ordered one and I'm following it. He also said, a lot of these clinics are popping up like in alleyways and people just pop in there to get their little pills. So I was like, okay, so I took a picture of my office complex today to put up there for you guys in a comment. We are on Montclair in between National and Fremont, and our office takes up tons of acres, several blocks. We're with attorneys, CPAs, dentists, other doctors. Like, come on.
Yeah, we've been in that office space since 2018.
18, yeah.
And then before that, we were in an office as well here in Springfield. And then before that, we were in an office in Ozark.
Right.
So, yeah.
So she told him, you know, I'm on the cream and not the oral. And he said, it makes no difference. They all get into the bloodstream. And I was like, so does like every single blood pressure pill. But, you know, we order different blood pressure pills to act on different parts of the kidneys. And then he told her, stop immediately, but gave her no directions. And then she kept saying, he just had this goofy grin. He just had this goofy grin the whole time. And I was like, that was sarcasm. He was so irritated that, you know how you talk like this sometimes to your kids or your husband when you're like, you know, like, because you know it, right?
I get it. Yep, that's the crazy face you gave me. You've been giving us for 20, the boys and I have been giving me that for 29 years.
So look at my note. This is what I wrote.
Okay.
I tore off her name and stuff. I wrote, number one, provider is misinformed regarding BHRT, bioidenticals, and clots, and giving out misinformation. Number one, patient is on transdermal estrogen. That's cream. Number two, even oral E2 is estradiol would be fine. Clots are associated with Premarin, pregnant horse pea. Number three, we never use Premarin. So stop it. Stop it. I'm annoyed. Really, I'm annoyed, not because of this, okay? I'm annoyed that people like him are preventing people from getting help.
Yeah.
If she would have went in, I kid you not, I'm not exaggerating, on 2 antidepressants, a statin, a couple blood pressure pills, a Xanax for breakthrough anxiety, Ambien to sleep, he would not have said one word.
Yeah.
But because she's on hormones, she has to get off of them. Immediately was his word, immediately.
Yeah.
On what information? He doesn't have any. You did not learn that in school.
Well, it's frustrating for the patients because they're not getting the treatment. It's
Right.
frustrating for you because you go out of your way to learn all this stuff and become, a professional or a subject matter expert in it, and you get questioned all the time, and it's difficult for you to deal with that. And not that questioning is bad. It's okay to question stuff, but if you don't know what you're talking about, don't talk about it. What's the analogy you always use about brain surgery?
Right, like don't come to me and ask if your neurosurgeon's doing a brain surgery correctly. I don't know. Even if he learned a little blip of hormones in medical school, which he didn't, I promise you. How long ago was it, and how long was the blip? It's like people like me with Hashimoto's, which is autoimmune hypothyroid. Endocrinologists always want to act like, you aren't feeling this, or it should be, but you're the one living with it. And we learn about Hashimoto's. It's like, honestly, in the endocrine chapter under thyroid, it's like 2 sentences. So just stop. And I don't want to say stay in your lane, because you can be a layperson and know something about a certain subject that you're interested in, but that was complete misinformation.
Yeah.
Complete misinformation. Now she knows enough. She was arguing with him, which also is what ticked him off.
Yeah.
She bruised his ego, but because we know her socially. So I know that she's smart and gonna just say what she thinks. And I know she's beautiful, and it just irritated him.
Yeah.
You don't ask questions. They are the doctor. Okay. And that was the first of like 3 today. So.
And we are almost out of time. We're at over 10 minutes now. So
Right.
we'll
I
have
had
to
a
say-
whole list of what happened today, but
Well-
I'm just going to do one for now.
Yeah, we can just do the one and then we can talk about the other ones on different what's for dinner. So anyway, anything else? Any other thoughts?
No.
Okay. Right on. All
Just
right.
be careful who you're listening to. Okay.
Yeah, for
If
sure.
you need brain surgery, go to a neurosurgeon. If you need hormones, don't go to a hematologist.
What about dietary advice?
Don't go to any of them. Come to a health coach, Low Carb USA,
Dr.
someone.
Tro, Dr. Brian Lenskis.
Right, all of those things.
Dr. Cyphus, all those super
Ken
awesome
Berry.
guys. Ken Berry, yeah.
Anthony Chafee.
Yeah, they're all awesome. So, and interestingly enough, there's no school for that.
No.
They have to go and they have to learn this on the side, They
All
have to do
over
it
again. And then
all
once
over.
they do, I mean, I'm one of them. You're super irritated that like this stuff was hidden, and then people call us crazy. These guys that I just listed, including me, your license are threatened. Like,
Yeah. Wouldn't be the first time.
no, but what am I supposed to do at heaven's door when God's asking me, I gave you the skill, I gave you the knowledge, and I gave you a platform. Why didn't you do it? I have to answer to that.
Yeah.
So,
Right on.
okay.
All right, guys. Well, thanks for listening, and let us know what you guys are having for dinner. If you have any questions, shoot them our way. We love you all. God bless, and we will see you next time.
Bye.
Bye.